Hey guys, Dr. Chris Miller here from ChiroSport Specialist. This week's video is a very important one because we get asked this all day, every day. Some days I feel like a broken record, and that's what exercises should I be doing for my lower back pain. Now I'm going to put a disclaimer out there. These exercises are for a majority of our patients and they're for a majority of the general population, but it's important to get evaluated to make sure that these exercises are the best for you. So I'm going to go over the four poorly, not just performed, but the four worst exercises you could be doing for your back, explain a little bit why, and then four better alternatives. So we're going to jump in. Here's number one, is just standing toe touch. Now remember this word, flexion. That exercise, when I'm bending over, I'm flexing. It feels good because I'm stretching my lower back, but we spend so much time now sitting at a desk, driving in the car, and then we get home and we sit on the couch, so we're spending so much time flexed. Now no matter what position I'm in, perfect posture all day, every day, perfect desk chair, doesn't matter. When you're sitting, you're flexed. What we need to do is extension exercises because we don't do any extension. And that's a lot of the cause of lower back pain. It's too much flexion. So here's the other exercises. This is the sister exercise to the standing. It's just seated flexion, the classic toe touch that we did in gym. However, we're flexing our lower back. If we have a disc herniation, disc bulge, or even just nerve irritation, sciatic pain down the leg, this is going to make it worse. Even though it feels better, I'm stretching my lower back, well 10 minutes later you're going to be like, why is my back hurting? It's because you're doing these exercises. Here's the next one. This is the most common culprit we see, is just this guy here, which is knee to chest. Again, I'm flexing my spine. I'm flattening my spine against the table. That's flexion. Now, I'm not opposed to just sometimes like one leg, knee to chest, stretching our glute, or an exercise like this to stretch the glute because I'm not flexing my spine. So that's okay to do. Here's the fourth one. Child's pose. Again, it feels good. I'm stretching my lower back, but later on in the day, your back's going to start hurting again, and you're like, why? And patients ask me, why is my back hurt after I stretch? Well, this is why. So child's pose, I'm flexing my lower back. So like I said earlier, we're spending so much time flexed all day, sitting, car ride, doesn't matter perfect posture or not, flexion and repeated flexion is the cause of lower back pain. So why would we want to stretch and flex more? So here's the alternatives. We're going to do, like I said, opposite extension. Here's number one. We're going to do cat-cow, the classic yoga. Everybody's seen this, or mostly everybody. Yes, I'm flexing my spine a little bit, but I'm just trying to get some movement in there because we're spending so much time just in a static flex position. A little bit of moving is not bad because now I'm not weight bearing. Okay, so do about 10 of those, then go straight into a cobra. Sometimes I'll just do a sustained cobra and just hold here. Sometimes even at night, I'll lay on the floor, play on my phone, watch TV, and kind of this static extension to help counteract some of the flexion because I spend all day bent over, flexed over a table working on patients. Okay, so that's number one. Child's pose, or not child's pose, cat-cow. Number two, cobra. Here's the third one. Standing extensions. You can do this throughout the day. We recommend generally, so push and bend backwards. You can do 10 of those in a row. We generally recommend, if you're sitting at a desk, take a break every 30 minutes. 30 minutes is kind of the max that we'd like to have you in a seated position. So just get up. Doesn't have to be for long. Just get up, do 10 of those standing extensions. And that's going to help counteract some of that flexing. Now here's the last one. This is going to help counteract some of what we call lordosis or anterior pelvic tilt, which puts a lot of pressure on our back. It's going to be a hip flexor stretch. I'm going to do it on the table here. Okay, so what I'm going to do, tilt the hips backwards, lean forward, tighten that glute. And then you can even add a reach. If you can't see it on the camera here, all that matters, tilt the hips backwards. That puts tension on that hip flexor here. As you lean forward, fire that glute, which gives you a more stretch here. And then add the reach. Can't see it? Don't worry. Sometimes then you can even grab the leg to help get the quad a little bit more. If that one's too hard for you to do, here's the alternative, or if you couldn't see it on the camera, I can't see. This, you could just kind of hang, flex one leg, let the leg hang off, and then bend the leg back. That'll help stretch that hip flexor, and then you can kind of do some active hip flexor stretch. Obviously do both sides. And then bend as you go down. Okay, so here's the 4 most common exercises that could be causing your back pain. Standing flexion, the sister, seated flexion, the number 1 culprit that we see, knee to chest flexion, child's pose. Here's the alternatives one more time. Easy to do, 10 of each. Cat-cow, go right into the cobra, sustain cobra, 10 cobras, standing extensions, and the hip flexor stretch. Okay, thanks for watching. We'll see you next time.